Welcome back. This is now chapter 14. We're going to go on a very important aspect when immunology goes awry. We've got some issues to deal with when we focus on matters of the immune system. So, this is chapter 14, Disorders in Immunity. And there's, of course, this one is rich in just terminology, I guess is the best vocabulary. Immuno, of course, the immune system, and the study of the pathology of the immune system. And we're going to talk about hypersensitivities. And I don't know how many have experienced hypersensitivities. I'm allergic to poison ivy or urushiol oil. I learned that when I was 8 years old, rolling down a very sandy hill up in I guess it was in Maine. The hill was just loaded with poison ivy, and wow, that was my introduction to understanding what hypersensitivity was. Anyhow, and it's overreaction of our immune system. It's sort of a over throttling of the immune system, but it's important that we add this component to immunology because you're going to see this if you're working in a hospital or a lot of times it's an immune response of some kind. And the immune system, if working properly, uh, is there to serve and protect the invaders, the things that we love, is the microbes and the viruses and all that stuff. But also, I don't want to have you ever forget, the immune system also does away with cells that go rogue, in other words, that are potential cancer formers. So the immune system is really, really important in surveying and making sure that those things are in check. But there are defects. Now, I'm from a Scottish heritage, and being a Scots background, there's certain types of autoimmune type of things, and that is a dysfunction. But there are also other ways the immune system can dysfunction that are sort of in the category of over throttling, and they have a lot to do with causing inflammation, and just in general, inflammation for whoever is bad. Inflammation is never good, and unless, of course, you're fighting an infection. But the subtle day-to-day, the C-reactive protein test, you may see that in patients' documents and things. It's usually from 1 to 5, 5 being the worst, and you want to have things that are sub 1. It was originally set up for polysaccharide type bacteria. You could determine if you had an infection with pneumococcus or those sorts of organisms that produce a lot of polysaccharide, which you still can. But the C-reactive protein really is an indicator of how much response you're having that is related to inflammation. And 5 level is bad. In guys, men, that's a problem because inflammation can lead to diabetes and failures of other types of systems that are really part of our response to gluten. I know there's a lot of controversy about that, but I take a very simplistic approach because I am really into the probiotic. And for example, understanding food microbiology and understanding that when they make sourdough bread, the bacteria actually break down the gluten. So those who are sensitive to gluten, sourdough bread is something you can enjoy right away, and it's just the process that the bacteria actually break down the gluten part. But it's understanding that that type of diet, and including those things in our diet, help us modulate downward the inflammation. So our immune response, very similar to when you eat gluten and that sort of thing, you get a raise or a rise in the immune response, which is a problem. And so you can develop asthma. Uh, Now, I'll tell just briefly a story. My wife will kill me for this, but anaphylaxis. That's really bad. See, my wife is extremely allergic to certain types of smoke patterns from marijuana, that sort of thing. If a car drives by and somebody has and smoked some marijuana, even trace, I would say, parts per billion, she immediately will have an immune reaction to the point where, if left, without an EpiPen or some way of controlling it, would end up in the hospital with anaphylactic shock. We learned this years ago, and we spent two times in the hospital, and we've learned now to manage it. But it's one of those weird things that do affect us. And diabetes, of course, is the inflammation, I guess you could say, certain the cells that produce insulin and the compatible sides of uptake of sugars and things like that. All of those signals are dealt with. Rheumatoid arthritis is another type of abnormal immune response, autoimmune, and graft rejection. Unfortunately, we deal with that when we have transplants and the like. So we're going to talk about the overall immune system as it relates to when it goes wrong. Now, I took pathology, and you're going to probably take pathology. I used to offer a course for that at Miller Mott. And the idea is you learn more about the proper functioning of systems when you look at when they don't work properly. So pathology, even though it's a study of when things don't work, it really gives you a view of what it is or what the boundaries are for things that work properly. So think about that when I don't want to take pathology. Yes, you do. You want to take pathology because that really sets the stage for, of course, your business of understanding sickness and illness and what you can do to treat. But it also lets you know when the systems are working properly, what not to look for, I guess, from that standpoint. Immunopathology is the study of disease states associated with the overreaction of the immune response. Also covers the underreaction too. If we don't have a good reaction, bad things happen. So hypersensitivities are things like allergy and autoimmunity. Now, I like to bend the two. If you have an overthrottling or hypersensitivity, it may mean that not only do you respond to whatever the stimulus was, but you over-respond to it. And if you over-respond to it, it can damage tissues and things. Autoimmunity has a slightly different connotation, where it's not only damaging due to the targeting of the materials or the antigens that aren't supposed to be there, but it's also reacting to antigens of yourself. And that is really severe. That's very dangerous. So, hyposensitivity or immunodeficiency is the systems are incompletely developed, suppressed, or destroyed. Now, there are times where these things happen. We purposely suppress the immune system when there's folks that suffer from things that overreact. And knowing how to throttle down or to lower that sometimes lead us into hyposensitivity. So you're actually trying to treat somebody, let's say for cancer, and you damage the immune system in the process of doing chemo and those sorts of things, and then you get into the hyposensitivity. Then you run into the risk of having other cancers form because you're not getting the surveillance of the immune system, or you get infections and various things that you don't want. So you can see the balances are really important here, and that's why I wanted to include this chapter. It's really important, and also gives us a good feel for when the immune system's working right. We really appreciate it. So here in one slide are really the things that we want to talk about. We have primary immunodeficiencies, like the child that was in the bubble. He was, essentially his immune system is such that he doesn't have any immune system, uh, or you have to take supplements and various things for allergies and immunodeficiencies. Those are hyposensitivities, and you can take drugs to complement those types. Or hypersensitivities, we have type 1, 2, 3, and 4. And we have the immediate type 1, hay fever, anaphylaxis. Type 2 is blood incompatibilities, and those are usually mediated by the antibodies raising to your own. Um, Type 3 is immune complex, rheumatoid arthritis, serum sickness, and then type 4 is cell mediated cytotoxic, contact dermatitis, graft rejection, serious type things like that. So I do want you to know these. This is important. You'll be coming across this routinely in your practice in medicine. Really the hypersensitivities, you see this a lot, and folks of course become stat when they have certain types of reactions. Let's say a snake bite, or bee stings, and they've had too many bee stings, and then they start to have a anaphylactic type of reaction to it, a type 1. It's good to know these sorts of things. IgG and IgM mediated cell damage. This is usually the blood group incompatibility or pernicious anemia, which just runs in the Scottish bloodline. That's great. And myasthenia gravis, different types of immune types of conditions. And then antibody-mediated inflammation, circulating IgG complexes deposited in membranes of target organs, and lupus erythematosus, that's really a sort of immune response to your DNA damage from the sun, the UV, and you start to see that characteristic redness around the eyes and nose and cheek, upper cheek type of thing. Rheumatoid arthritis is just the destruction of the joints. Serum sickness and rheumatic fever are also part of these immune complex. Then T cell mediated are the delayed hypersensitivities, type 4, cytotoxic. In other words, these are things that kill cells, and these are infection reactions, contact dermatitis, and graft rejection. And again, urushiol would be a good example of poison ivy for the contact dermatitis. And I just rewrote the same thing in a sort of a table that I like to summarize and get precise or cut to the chase. And so type 1, you can see the cellular components that actually lead to the types of the reactions, the anaphylaxis, and the allergies. The mast cells, of course, have IgE, the antibody is stuck into the membrane of the mast cell, allowing the antigen binding regions to be free. When two of those or more are bound by the antigen, it releases all sorts of these allergens, or not allergens, but elements that are highly reactive, and histamines and things like that, and that cause the allergies, and then anaphylaxis, where as a resulting of the release of these chemicals, you get airway constriction and all sorts of other things that are not pleasant, but it's all mediated by the IgE that's sitting in the mast cells, and also basophils. Type 2, IgG and IgM, macrophages is really responsible for processing antigens and complement activation. So again, these, all of these are involved, the neutrophils and the NK or killer cells, things like that. But macrophages really primarily make up what's going on. And I'll do this in my notes when I was going through school, is that the majority of the reactions would be with the macrophages. So I find a lot of times the questions will come for the majority, and sometimes would add the others, but association with macrophages, and autoimmune hemolytic anemia, type 2 type stuff, and Goodpasture syndrome, things like that, are associated with the cytotoxic. Type 3 is the immune complex. This is the antibody antigen complexes. Neutrophils are the big the cellular components involved, and you get lupus and the typical type of hypersensitivities that cause the type 3 that we see with the serum sickness and the various things that we just talked about with lupus and rheumatoid and serum sickness and those sort of things. So these are all arthritis type related. Type 4, the humoral components are the T cells and macrophages, and these are the contact dermatitis. And if somebody has the tuberculin test, that's the type 4 is what we're looking for with the if you've seen these sorts of antigens and that sort of stuff before. So which is the following is not a result of abnormal or undesirable immune function? And that would be fever. We talked about all the others. Fever is not as a result of an abnormal. It's normal to have a fever, and we want a fever to get rid of some bacteria or a virus replication or whatever, and so that would be the right way to go with that. So now we're going to summarize and blast into 14.2 to summarize genetic and environmental factors that influence allergy development, identify conditions caused by AGE mediated, 2 clinical forms of anaphylaxis, and then list 3 main ways to prevent type 1 types. So again, it comes down to vocabulary. An allergy is an exaggerated immune response. Really, we know that when the mast cells start to release histamines, the runny nose, and all the cascade of events that go around histamine, and that's why you take antihistamines and that sort of thing to try to offset the effects of that. Allergens are innocuous substances that induce allergy. In other words, they're immunogenic components of things that are substances. They could be in the air, could be dog dander, could be all sorts of things, perfumes, it could be chemicals of some kind. Let's say we have a chronic local allergy such as hay fever, with atrophy, or anaphylaxis, which is systemic. So we have local atopy, atophy is the way I've always heard it. Anaphylaxis is systemic, sometimes fatal reaction that really just shuts down the airways. When I was growing up, I had the croup, and the croup is an immune response to some allergen that's in the environment, and the airways would become obstructed, and it's a form of anaphylaxis. It's really scary stuff. So when you have patients that are going through this, I can tell you, it's not breathing is not a good thing. So in the U.S., nearly half the population is affected. So are you going to see these patients? Yes. Airborne allergens, dust, pollen, molds, a lot of molds. The dark molds, the darker they are, the worse they are. They can be really, really, it can affect sleep, it can affect all sorts of things. Type 1 allergies, majority are relatively mild, as they say here. Asthma and some food allergies may require hospitalization. And, peanut allergies, you see this in children and adults still, understanding those sorts of things. Some allergies last for a lifetime. Some are outgrown and others develop later in life. And I can tell you that I've been loving the effects of some allergies that last for a lifetime. At least I know what they are. So who's affected? A generalized susceptibility to allergens is inherited and not allergy to a specific substance. The genetic basis for atopy is increased IgE production, And of course, that's the reactivity of mast cells. In other words, if you coat the mast cells with even more IgEs, all it takes is an antigen to tie up two of the Y antigen binding regions of those antibodies. So you just take two of those antibodies adjacent that will cause the mast cell to start releasing histamines. Increased susceptibility of target tissue to allergic mediators. And so there's certain nasal respiratory areas and various things. And the prospect of a child developing the atopic allergy is 25% of parents are afflicted, 50% of siblings or grandparents are. In other words, it's genetic, and it's recessive trait, or you may see that both complements express that trait, and you'll unfortunately have really bad allergy type of events. The hygiene hypothesis. This is one that I remember growing up. I live near a farm, and so I got exposed to a lot of different antigens. I was outside a lot and that sort of thing. The industrialized world has created a hygienic environment where antimicrobial substances, well insulated homes, and the like. So the immune system doesn't get the training that it needs early on to determine what's self and not self and all that. And children that grow up on farms have a lower incidence of types of allergies. So what they're trying to correlate here is the more allergies you see as your immune system's developing, the better off you're going to be. And that's really what they're saying here. So breastfeeding, newborns breastfeed exclusively for the first 4 months, have a lower risk of asthma and eczema, and a lot of this is conferring certain types of antigens that exposures to that the babies will start to develop. The passive immunity is one thing with the antibodies, but also the antigens will be present. Cytokines and growth factors in milk act on the baby's gut mucosa to induce tolerance to allergens, and I think that's extremely true. I think that's a really important factor as setting up the baby's gut mucosa. And the microbiome project has shown 600 species of bacteria can be transferred to infants. So establishing that gut flora is really, really important, and development of tolerance. And I think that is key. That's one of the reasons why I focus so much on probiotic. As with all antigens, allergens have certain immunogenic characteristics. Proteins are more allergenic than carbohydrates, fats, or nucleic acids. Proteins seem to be very allergenic. Some are haptens, which are the components that actually cause the immune response. A non-protein substance with a molecular weight of less than 1,000 can form complexes with carrier molecules in the body. And when it does, it kind of presents that particular immuno allergen that because the carrier molecule has those haptens coating it, and that's a problem. And that's why a lot of times, you're spraying and doing various house cleaning and things, and then all of a sudden your nose is running and you're having your redness of the eyes and all. Well, that's because of these haptens being carried around. It's amazing. Cosmetic, foods, all sorts of things can do this. So the allergen portals of entry, the mucosal of the gut, respiratory tract. And you think about the area that the lungs have. Pause for a second and think about that. If you were to lay out on a flat surface all of the surface area that are within the alveoli sac and the air, it would be a huge area. And so that is one that we have to be careful, because it's easy to get things in, it's harder to get things out. The skin, which is our largest organ system, has dry, tough keratin, and it's less permeable, and it's kind of designed to be a little bit rough and tough, but access still can occur through tiny breaks, glands, and hair follicles. You get the ingrown hair and various things like that. But the mucosa is a very complex environment, and there's one of my uh, pet peeves is leaky gut syndrome, and it's really the disruption, the normal disruption of the normal functioning of that environment of the gut lumen. It sort of channels and allows certain things to pass through, like high fructose corn syrup and things like that, and it really contributes to obesity and things like that. Are really bad. So inhalants, airborne environmental allergens. I did a fair amount of work in looking at aerosols and various things. I wanted to understand how a air sac disease in poultry was getting transmitted, and that was actually sort of a cover story for research to look at how inhalants really can communicate disease, and how easy it is to do that, and especially in incubators and things like that in the animal industry. But it relates to house dust, dander, fungal spores, and things that we inhale. And those, as we know, when pollen is huge, we have a lot of the respiratory therapists make a lot of money during that time. Ingestants, allergens that can enter the mouth or cause food allergies. Of course, red dye, number 40. It's banned in some countries. And peanuts, shrimp, strawberries. Injectants, allergies triggered by drugs, vaccines, or the hymenopterin, which is a bee, the venom itself, and that, of course, can cause all sorts of problems. Contactants, allergies that enter through the skin. Many are type 4 or delayed hypersensitivities. Lotions, latex gloves, detergents. And I'm really hypersensitive to a lot of those things. It's just who I am. Even elastics and things like that is a problem. So the role of mast cells and basophils for type 1. Mast cells are located in all connective tissue, but particularly in high concentrations in the lung, skin, gastrointestinal tract, and the genital urinary tract. And you can imagine these types of cells are similar to the oral mouth type tissue and early parts of the upper parts of the lung. And so the mast cells are the ones that produce these histamines because of the IgE antibodies in the surface. Each cell carries about 30,000 to 100,000 cell receptors that bind IgE and granulate, releasing the cytokines or the histamine. And so degranulate means that it starts dumping these materials. So when antigens bind the IgE, it degranulates, releasing these cytokines. Symptoms of allergies are not caused by the direct action of allergen on tissues, but the physiological effects of mast cell derived. In other words, once you trigger the mast cells, then it's sort of like a cascade of effects on the target organs, and you'll have hell to pay. Histamine, the most profuse, fast-acting allergenic mediator. Histamine and I have a long history. Constricts smooth muscle in the small bronchi and intestine, causing labored breathing and increased intestinal motility. The stomach activity. Relaxes vascular smooth muscles and dilates arterioles, venules, resulting in wheal and flare reactions in the skin and itching. Boy, we know that. Stimulates eosinophils to release inflammatory cytokines, escalating symptoms, of course. Cascade of effects. The bradykinins prolong smooth muscle contraction of the bronchioles, dilation of peripheral arterioles, and increased capillary permeability and increased mucus secretion. So all these things lead to the snottiness, and we get more of the fluid retention and all those sorts of things. And then serotonin affects complement of those of histamine and bradykinin. So these effects of serotonin are, again, just a cascade of effects, and it exemplifies. So you can see over here the histamine intolerance symptoms, what they listed in the book actually translates to symptoms. And your job is to recognize a lot of these symptoms to see how we can best treat them. And racing heart, palpitations, nausea, diarrhea, muscle and joint pain, cramping, various endometriosis, difficult breathing, chronic coughing, and a lot of those we can recognize as allergic type symptoms. Leukotriene, various things like that, slow reacting substance of anaphylaxis, induce gradual contraction of smooth muscles, prolonged bronchial spasm, vacuolar permeability. Well, you can see these things again have a specific effect on the receptors, and it causes these sorts of changes in the long term, trying to deal with whatever to get rid of the allergen. But unfortunately, we have to live through the effects. Prostaglandins regulate smooth muscle contraction, vasodilation, vascular permeability, and sensitivity to pain, bronchial constriction. Non-steroidal anti-inflammatory drugs prevent the actions of these prostaglandins, and you can see where a lot of these work. I'm not interested that you know these details, but it's nice to know that the receptor type of idea that we've been talking about, other types of things, systems apply here. So it's not too foreign. Cellular reactions during type 1, of course, you can see using this diagram. The lymphatic vessel carries allergen to the lymph nodes. The lymph and B cell recognizes the allergen, helps the T cell. It proliferates, making antibodies. Then the IgE binds to the mast cell. Then the antigen binds to all it takes is you see that particular antigen binding region of that antibody also binds to that one. Those two are tied down. It starts to release histamines. That is parts per billion. In other words, you get one allergen, it ties down two of these antibodies. That's all it takes to trigger a mast cell to start degranulating. And there you go, and it's dumped into the blood and it's systemic. And this, let me tell you, it does not take much. And sometimes we start making more and more of these the IgEs to a particular allergen. You can see, like with my wife, with her marijuana sensitivity, 1 part per billion. I swear, it's amazing. Somebody can drive by, could have it on their clothes and walk by, and she's immediately having a reaction. It makes me a believer how powerful this system is when it's not working properly. So we get the prostaglandins with dilated blood vessels, constricted bronchioles, histamine, serotonin, and bradykinins, increased blood flow, skin manifestations, so very common, increased peristalsis, intestine, diarrhea, vomiting, and increased secretions. And so I'm sure everyone can relate to those. Hay fever, generic term for allergen rhinitis. Seasonal reaction, we see that a lot in North Carolina with plant pollens and particular molds in the homes. Moisture, and then it kind of grows the mold, and then it becomes dry, and then the spores are kicked up. Animals, all sorts of things. But respiratory membranes are the big ones. We get nasal congestion, coughing, profuse mucus secretion. Problem is you don't breathe as well, and so activity, you get asthma-like effects. And speaking of which, respiratory disease characterized by episodes of impaired breathing due to severe bronchial impairment and bronchial constriction. Airways of the asthmatics are extremely sensitive to minute for the same reasons, but think about the huge amount of area that the lungs carry that we've already discussed. Symptoms range from labored breathing to fatal suffocation, which is terrible. That is not really, that's not good at all. And rales. Rales is a clicking, bubbling, or rattling sound in the lungs. You use stethoscopes to hear this. uh, clicking, and that's why doctors do that a lot of times, is listen to the lungs and they listen for the clicking and bubbling, and then they know that it's an asthma-like effect, and then there's drugs that you can try to alleviate some of these. So serotonin and leukotrienes we've already kind of talked about. Atopic dermatitis, eczema, intense itching, inflammatory conditions. Sensitization occurs through ingestion, inhalation, and skin contact. Uh, a lot of times you'll see skin lesions on the face, scalp, neck. You can see raised areas. That's pretty exaggerated, but that's, yeah, it can be that way. Progresses to dry skin, thicken. It will go into a retirement home and look at the shins, that the skin thickens and all that. It's usually due to blood stasis, and you have really a reddening and encrusted skin lesion. It's an allergy to your own blood stasis, and it's toxic. Oxygen is toxic. Lesions are itchy, painful, and predisposes to secondary bacterial infections. Food allergies are really common: peanuts, fish, cow's milk, eggs, shellfish, soybeans, those sort of thing. Of course, you eat it, ingest it. And I would add gluten to this. Gluten isn't the same gluten as your parents grew up. I can attest to that. About in the early 80s and 90s, it became genetically modified. It's much more antigenic, and I don't know if that's by design or whatever. I won't go there. It's financial incentive somehow. It probably is cheaper to make or whatever. But you eat these sorts of things, and you'll get vomiting, diarrhea, and abdominal pain, hives, rhinitis, asthma, and occasional anaphylaxis. And it's the IgE type, degranulation of mast cells. Not all reactions involve this mechanism. So egg whites. A lot of times they'll use egg whites in vaccines because it's a protein that causes to complement more of an immune response, and then you're making antibodies against the particular antigen they're after to get you to be. But it can happen from a vaccine. Drugs. Now everybody has a different reaction to drugs. Sometimes it's severe. Sometimes you don't have any reactions. Drug allergies are one of the most common side effects of treatment. 5 to 10% reactions ranging from mild rash to anaphylaxis. So a lot of times, well, so and so didn't respond to that, but this person did, and it's all due to their genetics. Antibiotics, the penicillin's a real famous one, being resistant. What they found was the early days, the penicillin wasn't as clean, and there was a lot of other allergens in it. And sometimes, if your parents were, say, allergic to penicillin, they may not be now. Synthetic antimicrobials like sulfa drugs, anything with sulfur in it tends to be highly reactive. Aspirins, opiates, contrast dyes used in x-rays, also those that are used in upper and lower GIs, those contrast dyes. Allergens not the intact drug itself, but a hapten given off when the liver processes the drug. So it's not always the drug itself, and a lot of times you'll see this as, that, well, this, our product doesn't cause that, but your liver breaks it down, and then that becomes the more active. And this happens so many times. That's why some of the artificial sweeteners, they break down and turn into ethylene glycol and other nasty things. The liver does, that's what it's supposed to do, and it's a natural process. And we'll come back to this concept of the way the liver processes the drugs and causing some issues. But anaphylaxis is the overpowering IgE mediated allergic reaction. This is really, really dangerous stuff. Cutaneous anaphylaxis, wheal and flare, inflammatory response to local injection. Systemic, which is really bad, the sudden respiratory. Essentially, you feel powerless, your energy levels goes way down, and your breathing is really bad. Bee stings, injection of antibiotics or serum are most common. result of sudden and massive release of chemicals in the tissues and blood, and you can just see all the things that can be reacting. Uh, Blood testing, radio allo absorbent assays, or RAST, are measures of levels of IgE to specific antigens. Tryptase test measures tryptase, an enzyme released by mast cells to increase the allergic response. Differential blood counts reveal high levels of basophils and eosinophils, very common. Leukocyte histamine release test measures the amount of histamine released. So we have ways to diagnose an allergy and systematically. The skin testing, you can look at all sorts of things that are in your environment. I'm probably allergic to at least 30% of all that stuff. And you can see those reactions and measure them. You can see on the picture here how those reactions, you're going to see this very common in your patients, very, very common. Drugs that block the action of lymphocytes, mast cells, or chemical mediators. And you can see the blocking of events of an allergy, antihistamines, and that sort of thing. Desensitization, that's one I'm real interested in. Controlled exposure to an antigen through ingestion, sublingual absorption or injection, and trying to have your system throttle itself down in terms of making IgE to a particular allergen. Which of the following is not an IgE and or mast cell mediated allergic condition? And the systemic lupus erythematosus is wrong. That is actually lupus is. I don't know why the book company thinks. Why don't I'll leave this as if you want to email me what you think the right answer is to this, and IgE and or mast cell mediated allergic. Which one is not? And email me, and I'll give you an extra credit for that, for the right answer, because I don't believe lupus is the right answer for that. Okay, so next time I'll pick up at 14.3, and we'll talk about type 2, and we'll move on the role of blood. I don't know how many students know their blood type, but the Rh factor, or the rhesus monkey factor in hemolytic disease. We'll talk about that next time in the blood system, and that should be review. You already have had a lot of that, and that's good. So until next time, be safe, and I'll see you soon.